Nobody in that hospital knew what Harper really was. They saw a quiet nurse who moved too slowly, a woman who stared at blank walls when doctors barked orders. A liability, they called her. A problem. Brenda, the charge nurse, made sure everyone knew it. She'd lean into the hallway and whisper to the techs. I think she's medicated, honestly. Have you seen her? 2 full seconds before she even blinks. Dr. Hayes, the hotshot second year attending with his tailored scrubs and his easy laugh, had a nickname for her. The Tortoise. Chloe, the float nurse, giggled every time he said it. Harper just kept typing, kept her head down, kept her hands folded into the shape of someone ordinary. But her knuckles told a different story. Thick, discolored, crossed with faint silver scars that didn't come from paper cuts or missed IV sticks. If anyone had looked closely, really looked, they might have asked questions she wasn't ready to answer. So she made sure nobody looked. It was 2 a.m. when Brenda cornered her in Trauma Bay 3. Harper was pressing gauze against a drunk college kid's split forehead. Exactly 3 pounds of pressure. She'd been watching the clock, not the patient's face. The bleeding had stopped. She was almost done. You're going too slow, Brenda said, stepping into her space, elbow brushing her shoulder. We need this bay cleared 10 minutes ago. Harper's knuckles went white around the tube of surgical glue, just for a second. Then she forced the muscle to relax. Understood, she said. Flat, quiet. She finished the laceration, tossed the empty tube into the bin, and walked to the sink. Behind her, Brenda muttered to someone in the hall. I swear she's half asleep. Harper just stared at the cold water running over her hands. She wasn't medicated. She was managing. Civilian ERs were chaos, pointless, undisciplined chaos. Doctors yelling to prove they were in charge. Monitors screaming false alarms every 20 minutes. For the first 3 months on this floor, every alarm had shot adrenaline straight into her bloodstream, because where she came from, an alarm meant something was on fire. Someone was dying. A helicopter was going down. It took 3 months to train her body to understand that here, most of the time, it was just a loose lead on an old woman's finger. So she'd built a wall. She moved slow. She spoke less. She became easy to ignore. It worked. Right up until 3:15 in the morning when the floor shook. Not an earthquake. Not a truck. A rolling industrial shudder that rattled the blinds and hummed up through the soles of Harper's shoes before she heard a single siren. Boiler explosion. Meatpacking plant 4 miles down the interstate. And then the red phone at the charge desk started screaming. Brenda's face went white. Mass casualty. 6 rigs incoming. Crush injuries, burns, shrapnel. 2 minutes out. The ER came apart. Charts hit the floor. Chloe froze in the hallway with her hands pressed to her mouth. Dr. Hayes sprinted to the supply closet and dropped an entire box of gloves. Everyone ran. Everyone panicked. Harper stood up, pushed in her chair, and felt the pressure behind her eyes disappear. This was the thing about Harper that nobody in that hospital understood. Real chaos didn't break her. Real chaos made her quiet in a different way. The screaming faded. The noise became static. Her heart rate dropped instead of spiking. This was the state she had spent years being trained to find. And right now, standing in the middle of a panicking ER at 3 in the morning, she found it in under 4 seconds. The ambulance bay doors blew open. The smell came first. Scorched fabric, raw flesh, and the thick iron sweetness of hemorrhage so massive it filled the room like smoke. Harper knew that smell. She'd lived inside that smell for years. She ignored the first gurney. Hayes had it. She moved to the second one. Young male, maybe 20 years old. His left leg below the knee was destroyed. Shattered bone showing through torn flesh and denim. A paramedic was throwing his entire body weight onto the groin, trying to hold the femoral artery shut with both hands, and blood was still soaking through the sheets and dripping onto the floor in long, dark ribbons. Bay 2, Harper said, not loud. But the paramedics moved like she'd fired a gun. Chloe was already in the corner of Bay 2, frozen solid, hands over her mouth, staring at the leg. Harper didn't repeat herself to Chloe. She stepped directly into the pool of blood on the floor, reached into her waistband, and pulled out a pair of matty black titanium trauma shears that she kept clipped. "Out of sight every single shift. Move," she told the paramedic. "I can't. He's bleeding out. I have." Move." She drove her hand into the upper thigh. Not carefully, not gently. Deep, brutal, and exact, pushing past tissue until her fingers found the hard ridge of the pelvic bone and the severed artery pulsing against her palm like a cut garden hose. She clamped her fist shut. The bleeding dropped to a slow weep. Hayes appeared in the doorway, breathless. "What are you doing?" "You can't blind clamp an artery. You'll cause nerve damage." "Get out of the way." Harper looked at the patient's face. Grey skin, blue lips. 30 seconds, maybe less. "He doesn't have a blood pressure," she said, her voice dropping to something that didn't sound like any version of herself this hospital had ever heard. "If I let go, he dies." "I need a cat tourniquet, high and tight." "Combat model. Bottom drawer." "The black ones." Hayes stared at the blood soaking up her arms past the elbow. Hayes. One word. It landed like a door slamming. Now he found the tourniquet. He threw it. She caught it without looking, threaded it one-handed around the upper thigh, cinched the Velcro, twisted the windlass rod until the band bit down to bone, and locked it. She opened her fist. The bleeding stopped completely. "Line him," she said, stepping back. "Before he codes." Hayes stood there holding a tray, staring at her like he'd never seen a human being before. She should have felt something when the surgical team came and took him away. Relief maybe, pride. Instead, she just stood at the break room sink and watched. Pink water circle the drain and felt the adrenaline crash, settle into her bones like wet concrete. Then Brenda walked in. "You didn't chart the tourniquet application." "Not a thank you. A threat. I'll do it now. Hayes said you pushed him aside." "Said you were reckless." "Acting like a cowboy." Brenda crossed her arms. "We have protocols for a reason, Harper. I'm writing you up. Insubordination, breach of scope. You're a liability." Harper looked at her for a long moment. She almost laughed. The irony was so sharp it had a taste. "Write it up," she said quietly. "Just spell my name right." She walked back out to the floor. She put the wall back up. She became invisible again. Because it was easier. Because the truth of what she was and what she had done and what she had seen would have terrified every single one of them. It still might. The suspension meeting was in David's office. Director of nursing, a man whose scrubs had never seen a drop of blood. He tented his fingers on his laminate desk and used words like vigilante and liability and scope of practice, and Harper sat in the stiff, upholstered chair and stared at the motivational teamwork poster on his wall, whose corners were already peeling off. "Turn in your badge," David said. "Review board meets Thursday." Harper reached up for the clip. Her fingers touched the plastic, and the floor moved. Not the deep, structural shudder of an explosion, something rhythmic, concussive, a heavy thwomp-thwomp-thwomp that vibrated the light fixtures and made the water tremble in David's cup. Harper's fingers stopped moving. Her breath caught sharp in her throat. That was not a civilian life flight. Civilian life flights had a lighter rotor signature, a different engine pitch. What she was hearing right now was a UH-60 Blackhawk. She knew that sound the way some people know their mother's voice. She had fallen asleep to that sound in 3 different countries. It was on their roof. David's pager spun across the desk. He grabbed it, face going grey. Code yellow. Military transport. "They're already on the pad." Brenda stood up so fast her chair scraped the carpet. "We're not a military trauma center." "Why are they here?" "Closest facility. Something went wrong on a joint training exercise." Harper was already moving. The elevator doors from the helipad slammed open before they reached the ER. The smell detonated into the hallway. Aviation fuel, salt water, sweat, and underneath it all the sharp chemical bite of cordite. Harper stopped walking. Her stomach dropped. That was the smell of her nightmares. That was, unmistakably, the smell of home. 5 men came through the doors. They were not paramedics. They were enormous, soaking wet, covered in tactical gear, plate carriers, helmets with night vision rigs still mounted. They moved like a single organism, shoving an orderly out of the way without breaking stride, slamming a stretcher toward Trauma Bay 1 with an aggression that made the entire nursing staff step back. Trauma Bay 1, "Move, now!" The voice of the lead operator was not loud. It was a physical object. It cracked the air. Hayes was standing at the nurse's station with his coffee cup frozen halfway to his mouth. You can't bring weapons in here. Shut up and get a chest tube ready." The lead operator didn't look at Hayes. He slammed the stretcher into the bay. Harper stood at the edge of the central desk. Her heart was hammering. She was looking at the unit patch on the lead man's shoulder. A subdued trident over a skull. She recognized it. She had worn one DEVGRU. On the stretcher was a young operator, maybe 25. His skin was ash-white. His lips were the dark blue of someone whose oxygen had been critically compromised for too long. A jagged piece of sheared ship steel was protruding from his upper chest, below the clavicle. She didn't need to examine him. She knew exactly what was happening. Tension pneumothorax. The trapped air was crushing his heart. His airway was swelling shut from the blast impact. He was drowning, and he was doing it fast. Hayes rushed into the bay, reaching for the steel with shaking hands. "Don't touch that!" The lead operator slapped his hand away hard enough to knock him sideways. "You pull the seal, he exsanguinates in 60 seconds. We need a surgical airway and a chest tube, and we needed them 3 minutes ago." Hayes grabbed a laryngoscope. His hands were shaking so badly the metal blade rattled against the patient's teeth. The lead operator grabbed Hayes by the collar and lifted him off the floor. Completely off the floor. "I will not watch you kill my guy. Get me someone who knows what they're doing. Put him down." The hallway went silent. Harper walked through the glass doors. She didn't look at Brenda standing in the corridor with her mouth open. She didn't look at Hayes dangling from the operator's fist. She looked only at the lead man. She looked at his face, and she watched the fury in his eyes fracture apart like glass hitting concrete. "Chief," he breathed. His voice cracked on the single word. "Let the doctor go, Miller," Harper said. "He's no good to me with a damaged larynx." Miller set Hayes down. Hayes stumbled into a supply cart and stayed there, gasping, completely broken. Miller stared at Harper. His voice had gone soft in a way that was somehow more alarming than the shouting. "Doc Harper, what are you doing in Ohio?" "Trying to live quietly," she said. She pulled on sterile gloves. Her movements were different now. They had always been precise, but this was something else. This was the absolute zero of hesitation. The wall was gone. The box was gone. What was standing in that trauma bay now was the chief petty officer, the special operations combat medic, the woman who had held men together in the dark with nothing but her hands and her training and her refusal to let them go. "Report," she said. Every operator in the room straightened up at once. The feral panic vanished. They knew this voice. They trusted this voice. This voice had brought people back from places death had already claimed. Miller reported cleanly, crisply, like the professional he was. "Hull breach shrapnel during a VBSS drill. 2 units, whole blood pushed on the bird. Tensioning, airway compromised by swelling and jaw lock." Hayes. She didn't look at him. 36 French chest tube, scalpel, Kelly clamp. Chloe, push 50 of ketamine and 50 of rock. Surgical airway. His jaw is locked. Oral intubation is off the table. Hayes didn't move. "You can't. The protocol says..." Miller's hand dropped to the sidearm on his thigh. Not a threat, an instinct. The instinct of a man protecting his team's medic from interference. Harper didn't wait. She picked up the scalpel herself. Miller, head, dead center. Don't let him move. Got him, Doc. She found the cricothyroid membrane with 2 fingers, pressed in and cut. Vertical, clean, blood welled up, dark and immediate. Suction. Chloe, crying without making any sound, put the suction tube in her hand. Harper cleared the field, made the horizontal cut, and seated the breathing tube in the trachea in 14 seconds. Bag him. An operator grabbed the bag mask and squeezed. The patient's chest rose. The wet, drowning sound stopped. She moved to the side of the bed. Chest tube. She made the incision between the ribs without local anesthetic, because there was no time and he was already unconscious and dying. She pushed her finger into the pleural space, seated the tube, and the room filled with a violent explosive hiss as compressed air and dark blood detonated into the collection canister. The monitor stopped screaming. The jagged, panicked spikes on the screen slowed, smoothed, became a rhythm. A real rhythm. Steady and quiet and alive. Harper stepped back, dropped her gloves in the bin, looked at her knuckles in the harsh light. He's stable, she said. Keep him bagged. Surgical team needs to crack the chest to pull the steel, but he'll make it to the table. Miller pulled his helmet off. He looked at her the way soldiers look at the person who just pulled someone they love back from the edge. It was not admiration. It was something deeper and quieter and harder to name. Thank you, Chief, he said softly. You held the pressure well, Miller. Just like Kandahar, he almost smiled. She did, briefly. It was the most real expression anyone in that hospital had ever seen on her face. David was standing in the hallway with Brenda and 2 security guards who clearly had no intention of entering the room. He looked at the blood. He looked at the operators. He looked at Harper. Miller turned to Brenda. He looked at her clean scrubs and her clipboard, and his expression said everything. Your nurse just saved my teammate's life. You people don't have any idea who you have working for you. Brenda said nothing. She stepped back. David, Harper said, walking to the sink, turning on the cold water. Her voice had settled back into its usual quiet. Am I still suspended? David looked at 5 heavily armed Navy SEALs watching him with the focused intensity of men deciding whether a problem needs to be solved. No, David said. The review is cancelled. Harper scrubbed her hands. The water ran pink. The monitor beeped steadily in the bay behind her. The ER was quiet for the first time all night. They wouldn't call her the Tortoise anymore. They wouldn't mock her cadence or question her focus or whisper about her behind the nursing station. But they would be afraid of her now, and she knew from long experience that fear was its own kind of loneliness, heavier in some ways than being invisible. She dried her hands. The paper shredded against her palms. She walked back out to the floor. Her shift wasn't over yet.